Hello, I'm Stuart Childs and you're welcome to the Dairy Edge, the Teagasc Dairy podcast. We're bringing you the latest information, insights and opinion to improve dairy farm performance. With changes in legislation around the prescription of dry cow antibiotic which came into force in January of this year, I spoke with Willie Buckley, Veterinary Surgeon and Managing Partner at the Riverview Veterinary Group in Bandon. Willie is also a member of the Animal Health Ireland Cellcheck Technical Working Group, so is very well placed to talk about the change in the legislation. I started by asking Willie to explain how the change to the way in how he can prescribe will impact on how farmers approach drying off in 2022.
There's been a major change in how antibiotics or how vets can prescribe antibiotics. Vets can now only prescribe antibiotics if they know that there's infection there. So instead of in the old days where we treated all the animals with blanket dry cow therapy with antibiotics in it. Now it's the opposite. We will need evidence to show that a cow is infected before we can actually prescribe an antibiotic for that cow. So instead of treating mastitis as a whole herd problem, we will now be viewing it as a cow problem. So every cow has to be shown. Any cow that needs antibiotics at drying off will have to show signs of infection in that lactation. So there'll be a lot of cows will have no evidence of infection. They will not be able to get an antibiotic dry cow tube.
Okay, so that's and what's driving that then, Willie? What's the reason for the change? Why is the legislation after changing like?
Well, the legislation has got to do with antimicrobial resistance, and this isn't an Irish thing. This is a worldwide push to only use antibiotics when they're needed and where they're needed and as much as is needed at the time that they're needed. So there's no more use of antibiotics in a preventative basis, which is what was done in the old days. So let's say you had 100 cows in the old days. The old days mean last year, okay? So the old days was last year, this is this year. So the new days, now in the old days last year, you had 100 cows. You would give 100 cows antibiotics, but there might be only 25 of those cows have had signs of infection or infection in that lactation. So in the new days now, you will only be able to give antibiotic probably to those 25 cows. That's how it's working. So the other 75 cows in the old days got antibiotic and they had no infection there. So that led to resistance, or it could lead to resistance from bacteria to those antibiotics. And they're trying to save, and the other reason they need to save valuable antibiotics for human medicine to treat infections in human beings. So a lot of medicines, a lot of antibiotics are being removed from use for vets, for food animals, to allow them be kept, because there's an increase in resistance of bacteria to antibiotics. So they need to keep the stronger antibiotics to treat these infections for humans.
Okay, so it's very similar. It's kind of moved now from, we'll say, pigs and poultry would have been using a lot of medicated feed in the past. They've been stopped doing that. It hasn't destroyed their industry. The same is true for dairy farming basically now. Like we can actually do this. And you have a number of clients that have been working with you in relation to doing sealer only dry cow strategies in the last number of years. How successful has it been for them so far?
Yeah, I would say we probably have 20 to 30% of our clients have tried and continue to use selective dry cow therapy, which means, say, as the typical 100 cow herd, some of them might only give antibiotics to 40, 50, 60, or 40, 50, 60% of cows might only get sealers, and the other 20, 30, 40% will get antibiotics and sealers. So what they do, so the clients that have used it, it's been a steep learning curve for them. Okay, it is. You have to be very, very hygienic when you're doing your drying off procedure. You have to mind your cows before you dry them off. You have to be very careful when you dry them off if you're only using sealer, and then you have to be very careful with them after. So we have clients that have been using selective dry cow therapy for 4 and 5 and 6 years and are very, very happy to continue using it. And we have some clients that are probably up to 70, 80% sealer only in their herd, which is great. And the other added benefit of all of this is that when they do use antibiotics on infections, then the antibiotics seem to work better on the infections that are there because they haven't been treated by any other antibiotics along the way. So every farmer that uses selective dry cow therapy, I would say every fellow that I deal with has said they're actually easier to cure after, because they haven't had a broad spectrum of antibiotics. The cows haven't been treated with a broad spectrum antibiotic. We have some fellas actually that have cows that have never got an antibiotic in their life, which is amazing. They'll be third, fourth lactation cows, and they have never ever got an antibiotic in their life.
Yeah, it's very impressive. So, like, obviously you can relate to success stories there, but we'll say as a practicing vet now out on the ground, while you have plenty of success that you can relate back to when you're trying to get people to think about this sealer-only scenario, that's literally, as you said, in the new days now, it's the new norm, basically, that famous term that's come out of COVID as well. But what's in relation to your own position, is it a concern for you in the practice? We'll say that everybody's expected now to go doing some proportion, if not quite a large proportion, of sealer-only now this year, like?
It will be a challenge, but it's a challenge that will have benefits at the end. Let's say I often say to fellas, forget about mastitis. Say if you had 100 cows and you have 10 lame cows, okay? You actually pair those 10 cows and deal with them. You don't put the 100 crows to a crate and then try and deal with all of them. You focus on the problem and you deal with the problem animals and you try and cure them. So it's the same thing with mastitis. You have to tune in on the animals that are infected. You have to find out they're infected as soon as possible. There is no problem accessing antibiotics for infected animals. No problem. And that's a big message we have to get across. If you can show cows are infected, we will prescribe, and we will prescribe. It's our duty to prescribe appropriately. So it's important that we know how long they're infected and what bacteria they're infected with. But we've no problem prescribing for cows that you can show are infected. So the big focus that fellas have to do is they're going to have to find out, target the cows that are infected, find them as early as possible. And the earlier you find an infected cow, the easier it is to treat. If you have a cow that gets an infection with a mastitis and it's subclinical, you can't see it, there's no signs of clots, and you're not milk recording, that infection in that cow is established itself for longer and longer and longer. So the longer it's in the udder, the harder it is to cure. And then you have to use more antibiotics to cure it. So the big focus for the next few years, and the focus of the fellas that do the selective dry cow therapy, is diagnosing, finding the infection as early as possible. And then it's actually very easy to cure if you find it early.
So that's actually early in lactation that you're talking about there now, Willie, as opposed to before drying off, even, like it's nipping it in the bud, literally, like.
Correct. Like if a cow gets a bout of subclinical mastitis in June and you're not milk recording, and you might milk record till September, October, and then you're trying to treat her with tubes or trying to cure her with antibiotics in the dry cow period, it's a lot harder. Whereas if she gets an infection in June with no clots, subclinical, and you find it in July, then it's way easier to treat. And you might only have 1 quarter to treat in the cow, and she hasn't spread it to other cows. So the earlier diagnosis of the infected cow is crucial to all these. So it's a real challenge, and it's a change in mindset for our clients. They're going to have to be more active in finding the cows as early as possible infection. And I suppose, like, there's different ways of doing that. Milk recording will be a key part to all of that.
Okay, yeah. So, like, what are people going to do, Willie, where they don't have that now at the moment? Like, obviously what you're talking about there now is identifying it early. So we're talking about the people that have milk recorded throughout 2022. Like, this is probably the real difficult question from your perspective as vets trying to prescribe here now. Like, what are you going to do with the people that have no individual cow data, like?
So the onus on us is to only prescribe when there's evidence of infection. So if there's no evidence of infection, we will not be able to prescribe antibiotic dry cow tubes. So the onus is now trying back on the farmer to have records so that that can show the cows are infected. So you're saying to me, if a fella has no milk recording, he's 2 months away from drying off, he will either have to individually sample those cows and probably do it twice, maybe 1 month apart coming up to drying off. He can CMT to identify the cows that are high, and you can actually identify the quarter as well, which is the value of the CMT. But it will be difficult for us to prescribe on the back of a CMT done by a farmer. Technically, we should be doing that CMT if we're going to prescribe on it. So the key thing for any fellow coming up now is you're going to have to take samples off your cows, send them off, get them cell counted, and do it twice before the dry period. So you have a better chance of identify those cows that are high. So going back to my 100 cow herd, if you have 25 cows with infections, you probably only pick up 15, 16 of them with one sample, and you pick up an extra 5 or 6 or 7 with the second sample. And then we'll be able to prescribe for your 25 cows the antibiotic dry cow tube. But if you've no evidence, we're not allowed to prescribe anymore. And that is the situation. That is the new norm, as you call it. And that's prudent use of antibiotics, because we need to keep these antibiotics for food animals as well, because if we're seen to abuse antibiotics in food animals, they will take them away from us, and then where will we be? So we need to keep as many antibiotics available to us, and so that we can continue doing what we do best.
So then, I suppose when it comes to when you're actually going down the route of prescribing or working with your clients there now in relation to sealer only, what information are you using? I suppose we've touched on it there now with the milk recording, obviously, to decide, are they suitable for it? What cows do they choose to use or to submit for sealer only? And I suppose the big question this year is, we'll say, for people that haven't done any at all, how many should they actually go doing? And we'll say, what kind of wriggle room have you potentially this year in relation to that now? Because you've actually said there now, you can prescribe the antibiotic for cows that are okay. So if somebody's done no sealer before now, and if they have a very good cell count, we'll say, for example, because there are herds out there that are good at managing cell count and aren't necessarily milk recording, but which creates its own problem then, I suppose, from your point of view. But so if we've 20 cows that have been identified as having problems, and we've a person that has never done sealer only, that's a tricky scenario for you to be in. What's the scenario? What is going to be the scenario for that person?
So Stuart, the scenario is, last year we were picking the cows that we're putting sealer only into. This year we're picking the cows that we're putting antibiotic into. It's the opposite. You're on the other side of the fence now. So every cow should get, I suppose, first principles. You will be a very brave farmer now not to use sealer on all your cows, okay? Yeah. Unless you have exceptional housing, exceptional history of not getting in trouble, not using sealers, you will be a very brave farmer not to use sealer on all your cows. So that's number one. We would recommend sealer on everything. So, and going backwards, putting sealer into a cow has to be done so hygienically, as one of the lads always say, it has to nearly be done surgically. It has to be done hygienically to the highest standard, so that you have a cow there with a quarter that has no infection in it. You're putting in a few mils of a sealer, okay? So you need to make sure that teat end is clean. You make sure everything you do is as sterile as possible. The procedure is well known, and you instill that sealer, and then you want to keep that sealer in that cow, and you want to keep her from getting any infection inside. So it is the drying off period. Going back, the recommendation is you should do no more than 20 cows at a day sealing them. So that's it. If you do 20 cows well, it's better than doing 40 cows half well, and you will suffer next year if you don't do it. And this is what people are going to have to do. So going back, how do you select the cows? It'll be easy to select the cows that will be getting the antibiotics if we have any evidence to say that she has a high cell count. The other thing, clinical records. If you can show me that these cows have had clinical mastitis, or clinical records, CMT probably done by a vet, milk recordings, individual somatic cell counts, those are the kind of things that we will need to allow us to do the antibiotic prescribe the antibiotic in those cows.
Right, then moving on, I suppose you've explained about the hygiene around the actual process of infusing the tubes and so forth. How influential then are good, well-maintained, clean housing facilities to the success of sealer-only scenarios?
What I see is, from the fellas that have done it before, okay, they are top-notch they have top-notch housing. Like you can't put a sealer hygienically and sterilely into a cow and then throw out to a mucky field, or leave her run down to the end of the farm, swinging or other, and the sealer coming out, and or bringing her in this evening with the rest of the cows that are milking, and she pushes down a big load of milk because she thinks she should be milked. So the fellas that do best at sealer only, they put in the sealer hygienically, very calm with the cows, do one stand at a time, one lot at a time, put all your stuff on one side of the parlour and do one lot of cows. Most farmers would have 8 to 10 runs of milking. So you do one lot at a time, or maybe allow you do 2 if you're very good, but that's as much as you should be doing. So 25% of your herd is a lot of sealing to be done. And you have to put them into clean, well, depending on the time of the year, if they're out, you want to put them into as dry paddock as you can, walk them out slowly and leave them away from the parlour as long as possible and keep a good eye on them. If they're inside, you have to put them into clean, dry, well-ventilated house with enough space for them. And they need to be, the critical time when you dry off a cow is the first 7 to 10 days. If you can get them over that crunch period, the next critical time for infection is when they spring up. So your springing up is your when they're bagging up to calve. So if you get them over the first 7 to 10 days, calm, without fussing them up, in as clean environment as you can, and you're doing the same when the cow comes up to calving, that's what you're looking at, and that's what the fellas do. They're religious about their dry cow housing. Religious.
Okay, so like, you're happy enough that once the sealer is put in properly, that if we do keep the hygiene side of things right and so forth, that there's no need to go doing anything else in terms of teat spraying before calving or anything like that, that the sealer will do its job if you can keep your cubicle hygiene good, keep your cubicles clean. And as you said, not overstock sheds, we'll say, where they're going to be wet because there's so many stock inside in the shed that there's water dripping from the eaves.
Yeah. So like, if you look at the value, I always say to fellas, say when you had an antibiotic dry cow tube and a sealer, okay, the biggest value for the antibiotic and the dry cow tube is curing the infection that's in the udder. So it's inside there for 3, 4, 5, 6 weeks, and it kills the infection over time. But the vast value that the majority of value you get from an antibiotic dry cow tube is in the first 3 or 4 weeks. The value you get out of the antibiotic dry cow tube as the cow is bagging up is only very small. It doesn't really prevent infection. It doesn't really do any of that. So the sealer is different. The sealer is designed to prevent any infection getting in. Now, if you put infection in with the sealer when you're going in, that's the disaster. But the sealer, once the sealer is instilled in the bottom of the teat, that should keep out anything else from going inside there, providing you don't mess her up or put her in an environment where she can pick it up. But the great value of a sealer, so I would say 50% of the value of a sealer is in drying off, but the other 50% is in the 2 to 3 weeks before calving, because that's a block to any infection. As the udder is bagging up and getting big and there's milk going into it, that's a risk time for infection as well. But the sealer really comes into its own in those last 2 or 3 weeks, because that prevents anything from getting in as well. So if you create the plug early, the plug will stay there until the calf sucks it out, or you suck it out with the machine, or you pull them. So it's creating the plug, and once the plug establishes itself, that is the glory of the sealer.
Very good. So I suppose for the people that are going doing this for the very first time now, what are your recommendations to do this correctly, we'll say, and to do it to the best of their ability for 2023, so that it doesn't become an unmitigated disaster, basically?
So first of all, find what cows that you have infected that you're going to use antibiotics with. Okay, so treat them like you treat the cows previously. Okay, so then I would say on average, fellas are going to have 25-30% of those cows that will get antibiotics. So you're talking about the other 70% that are sealer only. Like, I would honestly say 20 cows maximum. You need to seal them as hygienically. You need to focus on this, because what you're protecting is next year's milk production. What you're protecting is the future value of a cow. So every time a cow gets infection, you have a potential of damaging that udder. So the sealer, and also during the dry cow period, are drying off and bagging up. They're 2 critical times for picking up new infections. And they show any infections you pick up during those periods after drying off or bagging up. Sometimes they don't flare up until the first 30 or 60 days into lactation. And they've shown that they've the cow might pick up the infection. It can rest in the udder, And then when the stress comes on, when she's bullying or when she's hitting peak production, the body, the stress of bullying or whatever that, it causes a flare up of the infection, and that bacteria that went in at drying off or during the dry coat period flares up then. So it's a crucial time to keep things protecting next year's lactation. That's what you're doing, and especially with the price of milk, you've got to. That is like it'll be the single most important thing you'll do all winter. And I know that without a doubt, it'll be your single most important action for your cow for the next year.
Okay, so Willie, I suppose just finally, just to try and emphasise the hygiene piece of it, from the Teagasc consults, we'll say, which people can avail of, obviously through the government funding that's there for it. Almost all vets in the country now will have a vet in their practice that will be qualified to follow through on this. And you've done a lot of this now in the last few years. As you said, you've clients there that are nearly up in 6 years, maybe doing sealer only. So you were one of the first vets that was doing this. In terms of that, like, people, another man's clean is another man's dirty, as they say. Like, what's your observations in terms of what people, was there anything from the Teagasc consults that you would have taken away as being that people maybe thought that they had a cow's teeth clean before they were going and putting in a tube, and that they, like, that was one of the main recommendations that you had to keep giving to people, was like, it's not clean enough, like, it looks clean, but is it surgically clean? Like,
so the three things that I would have learned from farmers and why in these TASAs, in these conversations, is the number of cows you do. If you do too many, it's impossible to do it clean. Everything gets dirty, everything. Like the cows outside in the stand, you keep them there, they start dying after a while. So then you're trying to clean down that lot and you're bringing in the next lot. Everything starts getting dirtier and dirtier. So you have to do whatever you feel or whatever has worked for you in the past is the number of cows you need to seal. Okay, that's one crucial thing. Now, the other crucial thing that all of these farmers do is they milk a cord, Stuart. I'll go on about it again. They will milk a cord. So they'll have a milk cording before they dry off the cow, and that'll be low if they're going to seed her only. No, they will go to the first 1 or 2 milk cordings post calving, and if they're gone high and you have too many of them, you're looking at that. And say a farmer seals 70 cows, and I see 20 of them have gone from low somatic cell count pre-drying off to high post-drying off. I said, there may be a problem in what you're doing here, because they're getting infected either from the point that you took the last milk cording to the next point of the first milk cording. There is a problem. It could be a problem in how you're drying them off. It could be a problem with putting in the sealer. It could be a problem with dry cow hosing. It could be a problem with calving, box hygiene, pre and post calving, or your treatment of them in the first 30 days post calving. But if there's too many cows that you give sealer that have gone from low to high, you really, the first place to look at is your drying off procedure. That is the most likely time that you're going to put in infection. So these fellas are regimental in, they record on the milk card, and you can record if a cow got teat sealer only, if she got antibiotic tube only, or if she got both. So they go back, review the cows that got teat sealer only, and if there's a higher proportion of them getting going from low to high in the milk recording, they know something has gone wrong. If there's a higher proportion of them going high compared to the ones that got antibiotic, it's very easy to see it in the milk recording. The cows that got sealer only, a higher proportion of them go high, then there's something wrong with your sealing technique. And your sealing technique is crucial. And I go through sealing techniques with fellas, and fellas have different ways of doing it. But if the records show me that what they're doing is right, and that they have very low infection from the last milk recording to the first of the next lactation, I can say to them, whatever you're doing, keep doing it because you're doing it right. But if there's a problem, you have to find the problem there. So that is the biggest, and you have to milk record enough to get that more. The more often you milk record, the more valuable information you get. But milk recording and hygiene is everything. They are the two main things, I would say.
Yeah, so pretty much records, so be it cases of mastitis or actual milk data, obviously coming from milk recording, because no matter what way we go about this, when you're talking about individual cow sampling, the easiest way to do it is going to be through milk recording. So people can avail of the option there of doing recordings now before they dry off this year and continue to record next year. The idea of actually going and quarter sampling or sampling individual cows now and sending those samples away, it's great in theory, but it's not as simple in practice really. Like, so it's easier to go down the route of a milk recording, I would say, for people there. And then the other thing is that the whole hygiene. So records, and hygiene are the kind of the key words in relation to this process. Like,
yeah, that is what the fellas doing selective dry coat therapy are fastidious about those two things. They'd be teaching me, telling me stuff that they do and teaching me things that they do. It's because they're totally focused on it. And if you're focused on something, you will get a solution to it. Farmers are brilliant. If they focus on something, they will always get a solution to it. It's just that it takes focus, and it takes effort, and all the effort is being thrown back on the farmers now. But the one thing I'd say is the return for the effort is brilliant. Like, we have fellas maintain their cell count. Like, the worst thing about high cell count or mastitis is the hassle it causes you, and dumping milk. And like, dumping milk this year is not a thing you want to be doing with the price of milk and the cost of producing it. And next year it's not going to be any difference. So the cost of dumping milk is not going to change for a long time. So it's the hassle of having mastitis. So the effort that you put in will easily be returned.
Yeah, so like I often say in relation to vaccinations, etc. as well, like that you can do these things on your own terms, and drying off the cows is a bit like that as well. Whereas if you've cell count problem next year, like, you're trying to handle it in the heat of battle really, like, and it's a stress. It, like, where you and I have both seen farms that have been involved with high cell count issues throughout the full lactation really, because when it gets stuck into a herd in the springtime, it's very hard to shake it off, like, and you alluded to that earlier, like trying to nip it in the bud. But the levels of stress that farmers undergo as a result of that, it cannot be underestimated. And it's something that people will need to be very conscious of now, that hygiene piece, because the tendency is, I suppose, we're winding down now as we kind of move towards Christmas, we'll say, at the point of drying off, and that, like you said, there people just lack focus maybe potentially, and dry cow tubes have potentially been getting people out of that, or masking that lack of focus maybe. But it's just to be tuned in when we're doing this, being prepared for it, and being organised to do it and doing it correctly. And there's plenty, while there's plenty of risk associated with it, there's opportunities in it as well, as you said, less problems curing cases and so forth into the future as well. And obviously the big benefit, and why it's all there in the first place, is to try and reduce that resistance that could be developing in places too.
Yeah, so look, we will be reducing, all farmers will be reducing their antibiotic usage by 50% on most farms, and it will be the same with dosing as well. All dosing, all antibiotics will be reduced by 50%. And we have fellas that have done it with no deleterious effects on the farm whatsoever. And in fact, a lot happier farmers, a lot happier cattle. And, it does pay the effort that you put into it. Stuart, you're worried about the situation in regard to a huge changeover to sealer only on farms that aren't used to it. Okay. So I'm not as worried about that. Because what I see is, okay, you might not cure a few cows over the dry cow period that you would have cured in the past, but you'll still have a lot of clean cows that are going to be clean, that the antibiotic in the dry cow tube was doing nothing for, did nothing for 70% of cows, it did nothing for. So there might be a slight increase at the start of lactation for a couple of those cows that you didn't cure over the dry cow period because you didn't know they were infected. So if you act early then and chase them down with sampling or paddling or individuals' somatic cell counts from the jars or wherever you want to do them, you will get on top of that infection. And I actually don't have worries. Farmers will respond to the challenge of doing this. And once they see, you and me always get the calls, my cell count is rising. That's a great call to get, rather than the call, my cell count is at this, Yeah. So if you're monitoring, looking for the rise, you're in a great position. But if it's at a big figure by the time you get there, that's trouble. So you have to monitor and look for the rise in cell count. So that's the biggest job farmers will have next spring, is watching for any cell count rising and trying to find the root cause for it. Okay,
super, Willie. So thanks very much for coming on today and talking to me. And if people want to know a bit more about this, they obviously can attend some of the selective dry cow therapy events that are going to be on over the next 2.5 weeks. They're dotted around the country, and you should be after getting notification from your co-ops in relation to them. you can hear more from Willie and myself at some of those events. We'll be at some of those. So thanks a million, Willie. Appreciate your time, and I always enjoy talking to you, so thanks for coming on.
Thanks, Stuart. Take care. All the best. Bye-bye.
That's all for this week's episode of the Dairy Edge podcast, and my thanks to Willie Buckley for joining me on this week's show. Don't forget to rate, review and subscribe to the podcast. You can listen on Apple and Google Podcasts as well as Spotify, and for more information go to the Teagasc website at teagasc.ie. I'm Stuart Childs, and join me next time for your Dairy Edge.